It was back in November when Prime Minister Hubert Ingraham broke ground for construction on the Princess Margaret Hospital's $52 million critical care block, and 4 months later, Mr. Ingraham is surveying its progress. As Altov's Munnings reports, the upgrade marks the first phase of the government's plan to extend the hospital for the first time since 1976.
18 recovery beds, 20 intensive care unit rooms, 48 neonatal intensive care beds, a new main entry, and new laboratory facilities. That's what the Princess Margaret Hospital's new critical care block will house once it opens next year. This crucial part of the hospital will also offer doctors, nurses, and other medical staff the space and equipment to deliver the best levels of health care possible.
We have, over the years, been dreaming about having this facility. We are happy it's now able to come to fruition. The World Bank of Canada has been helpful in providing a loan of $55 million towards the project. The total project here is going to cost between $90 and $100 million, and the government will provide funding on top of the loan sum for the completion of the project. We have had the good fortune of having Bahamian professionals engaged in this entire project. And also a Bahamian professional who doesn't live in the Bahamas anymore, whose expertise and the connections we use to connection the project. We've had no difficulty so far. We don't anticipate any, and things are moving quite smoothly.
The 75,000 square foot addition costs $52.3 million to construct and will span 3 levels. As the cement mixes and the blocks are laid, the project's contractors, Cavalier Construction, are also pleased with the progress, although they had to overcome some challenges.
It will be a challenge right the way through to the end, but the biggest challenge that we've had is all the services in the ground to keep the existing hospital running. And we've come across a few challenges there, but so far, so good. We've done well.
We have some challenges with the existing utility companies. We're working through it, and it's a cooperation that's going to be required by all in order to make this project successful.
Public Hospitals Authority Managing Director Herbert Brown told the press that the new critical care block will fit into the organization's overall vision to provide residents nationwide an excellent quality of health care comparable to any leading facility in the world.
The fact that we have many surgeries that we are unable to accommodate in a timely manner, and the fact that we are going to have 6 operating theaters is going to be significant. The fact that we are going to double the ICU capacity from 11 to 20 is significant. The fact that we are going to significantly enhance the neonatal intensive care unit is significant.
Public Hospital Authority officials boast that the construction of the Princess Margaret Hospital's critical care block is the single most largest investment in the hospital's history. Construction on the block is expected to end by June 2013. Altov's Munnings, 7S News.
Prime Minister Ingraham also believes that upgrades to the national healthcare system will play a pivotal role in reducing infant mortality numbers. Mr. Ingraham wants to see those numbers decrease to the lower double digits or even single digits if possible.
There was a major retreat from where we had gotten by 2002. Major slippage took place between 2000 and 2007. This is not a political statement, this is a statement of fact. It's horrifying, the neglect which took place in that regard in the 5 years I was out of office. Unbelievably so. Unthinkably so. It is the poor in the society that requires government intervention for public health matters. The wealthy and the well-to-do are able to take care of themselves. And so I've always been concerned about this aspect of public health in the Bahamas.